Welcome to the I Am You podcast. I am your host, Dr. Nitza Alvarez, a board-certified cardiologist and best-selling author. My hope with this podcast is to share stories so women can speak up and become the CEO of their own health. I am a cardiologist. I am a wife. I am a mother. My story is your story. I am you. Hello, everyone, and welcome to another episode of I Am You podcast. Today, I have the pleasure to be joined by Barbara Canty. Barbara, welcome.
Thank you.
I am so happy that you're here. The
I am
audience
too.
is up for a treat with your story. So Barbara came to me. Barbara, I'm just going to give a little introduction, and then you're going to share the rest of the story with our audience and help them navigate the system the same way that you did. Okay, so Barbara came to me because she wanted to have a second opinion on the management of her cholesterol. No? So why did you decide to see a cardiologist, Barbara?
Because I had high LDL for years and all my other cholesterol numbers were perfect. And I was trying to avoid going on medication. So I came to you to get to the bottom of why the LDL was high and to see if I could stay off medicine.
Mm-hmm. So other providers have suggested that you take medications,
Yes.
and you were like,
Yeah, no.
I don't want to take it.
Right.
And so then you decide to see a specialist to see, of course, in your mind, you were hoping that we said, no, you don't need to take it, or we have other alternatives for
Right.
you. But at the same time, you coming to me also tells me that you want to make sure that you were doing the right thing.
I
no?
wanted to make sure there's history in my family on the male side, but never on the female side.
Of heart disease.
Of
or
heart
high
problems.
cholesterol.
Yes.
Heart problems in
Yes.
general.
Mhm.
Okay. So you came to me, we did the initial consultation.
Right.
And as part of that consultation, I told you, okay, so why don't we gather a little more data to try to understand if you have an absolute indication to be on medications or not? And I think that for the women that are going to be listening to this podcast, I think that's going to be one of the first messages that we're sending. No, you don't have to take medications if you don't need to, but
Right.
if there's an indication, you probably do. But then sometimes it's that gap in knowledge of, do I need it? And what is the evidence that I need it? How do I know that this is actually for me? And not only because of medications in general, because so many of the medications that we use in our female patients were never tested in women. So it's good to have the question of, is that a drug that I want to take? No? So as part of the journey, I said, okay, so let's go ahead and do some testing. And based on that information, then we can decide, do you need or you don't need to be on statins? And that is actually when the surprise came.
Mm-hmm.
So share with the audience,
So
what
my
do we do?
very last test was the stress test. So I did the stress test. I did 102%. I hit the number she wanted me to hit. But when I got off the treadmill and started to cool down, I got a little ache in the back of my shoulder blade. Now, I knew already that that was a sign for women. An
How
ache
come
in
you
the
knew
shoulder
that?
Because my old office manager had an ache in her shoulder blade. And my boss said, well, maybe at lunchtime you should go get that checked out. And she ended up with triple bypass.
Oh my God.
So I knew that that was a sign. But it was just a slight little ache. It was easy that somebody would just brush that off. But then I started to feel a little lightheaded at the base of my head. And I said, well, this might not be good. And I told the tech, and she went and got you.
Okay. So two things. You already knew, so that at least you were already over alert that this can be a sign that
This
something
could
is
be a
wrong with my
problem.
heart. And then also you decided to say something, because
Yes.
you could have easily said, I'm not going to say anything.
Right. If
This
I
is
didn't know
gonna
that, I
pass."
would have just thought nothing of it because I had hit the number and did 102%. So you would have thought I passed that with flying colors. But no.
So my nurse came to grab me in next door in my as I was seeing other patients, and I come in to see you and look at this test, and I'm like, this is abnormal. Yeah. So the test right there shows an abnormality and something very suspicious that something was wrong with your heart. You were feeling poorly, and I told you that you were going to go to the hospital from there.
Right.
That we needed to do more testing and make sure that we understood the mechanism of your condition. And even though you were suspicious or a little concerned that this could be the heart. How do you took the news when I said, we're going to the hospital?
You were the boss. I said, that's what I have to do. That's where I'm going.
Trusting the provider,
Yes.
no? So I came here to be cared by you, and if you're telling me that that's where I need to go, then that's where I need to go. You know, sometimes, Barbara, that when nobody wants to think about heart disease and the vulnerability that involves, no? And sometimes as provider it's a little sad and frustrating when you give advice and the patient go like, no, I'm not going, no, I'm not going to do it. And because we know that it's in their best, we're doing it for the best interest. So it's much easier when if we make a recommendation based on the expertise that we have. And I said, Barbara, we got to take care of this. To your surprise, because you came in to seek a second opinion for cholesterol management. And now I'm telling you something is not right.
Right.
Yes. So we took you to the hospital, and over there we did a more specialized test, which is called a coronary angiogram or a heart cath. And in that test, to your surprise,
To my big surprise.
we found out that you have an artery that it was significantly blocked
Yes.
and require stent. Yes? Mm-hmm. So when you learned that was an issue, that there was a major problem, did you ever even thought that could be a possibility for you?
No, because I was active exercising. I exercised probably 4 or 5 days a week. I have a good diet. I had taken everything over the years out of my diet that could have possibly been wrong. So there was nothing else to take out. So, but I was very surprised when it was blocked. Very surprised.
Plus, you were not having
Because
symptoms
I didn't feel
prior.
bad. No, nothing,
Yes, so
nothing.
it wasn't until we put you on that treadmill, which goes to say, you don't know until you know.
Right.
You know, when I use that motto on all my talks, and every time I have conversations, when people say, but why will I see a doctor if I'm feeling good? And I'm like, but you don't know until you know. And I think
No.
that your story is the best example, even though you did have a risk factor, 2 risk factors, not because you're postmenopausal. Yeah, we already passed that stage.
Yes.
Yeah, and then your cholesterol was elevated, but clinically you were feeling good.
I was feeling
there's nothing
fine,
wrong with me.
right.
Like, you didn't come to me seeking attention because you were not feeling good and you were suspicious that something was going on. It's like, I feel great, and then that's why it was a surprise. No, and that happens a lot. And in this case, we were blessed that we were able to detect the disease early before it became an issue for you, because so many times women don't have symptoms and they either end up suffering a heart attack, so we meet them in the emergency room because we have no idea because they've never been tested, or they actually end up dying, and then nobody knows what was the cause of their death because there was not an evaluation prior to that.
Right.
So with this information, then we have plenty of data to why we should be on cholesterol medication.
Yes, we
Yes?
Exactly.
So now, once we discovered that there was disease, then there was no questions. It's like,
No.
okay, so we definitely know that you already built up a disease, and we had to be proactive in reducing this chance from becoming an issue down the road.
Yes.
Now, with your journey, with your story, when you talk to your friends, what would you tell them, or what would you tell the women of our audience that are listening about this, how this transpired for you?
Well, you definitely should be tested. You need base scores. You need to make sure everything is okay. And then you need to listen to what your doctor says, because I fought going on medicine for years, and clearly I was wrong. So you really need to listen to the doctors, because they are looking out for your best interest.
Mm-hmm. And then also, if you know your numbers, like some testing that are so valuable and simple, like a blood test that can give us a hint of there's some risk factors that are present in there. And I think that we underestimate the risk factor of age. And I understand that nobody wants to talk about age, and nobody wants to go like, oh, really, we had to talk about getting old? No.
Yeah.
But it's in postmenopausal women, there is clear evidence that is after the menopause that women start,
Yes.
The risk for heart disease go up dramatically. So that is undeniable. If you are a postmenopausal woman and you never had an evaluation, then listen to Barbara's story. Like, Barbara felt that she was doing okay, that everything was okay. She feels good. She only wants to get my opinion about it, and we find out that there is disease.
Right.
So if you never had a checkup, this is for the women that are listening to us because you already had yours.
Yeah.
Get your heart
They're tested.
checked. Yes.
Because it could have been a totally different outcome. And who knows when it would have been an outcome. I mean, it was really blocked. It could have been not that long ago past that I could have had a really big problem.
Absolutely. So when we are creating these programs is to empower our women to be their own advocate. And part of that advocacy is you cannot say that everything is okay unless you know that everything is okay.
No.
And I think that your story is the perfect example of why it's not okay to say everything is okay and not take an okay from a provider that has not completed the proper testing, but also for a woman itself saying, I'm okay, you know. And then I say, okay, listen to Barbara. Barbara was exercising, was eating well. She tried to remove all those food that she knew could be potentially harmful for her, reducing the risk for heart disease in the future. And then we found out, oh, you know, if you don't get checked, we don't know.
Right, exactly.
So I want to thank you for seeking a second opinion. I want to thank you for being open to do the testing that we needed to do to get a better understanding of what your cardiac health was. And I thank you for being receptive to the recommendations. Because of you and your willingness to know and get better, you save your own life.
And thank you for taking such good care of me.
You're welcome. And thank you for sharing your story.
Thank you.
And this takes us to the end of another I Am You episode. Thank you for joining us. I hope this episode has empowered you to be the CEO of your own health. Tune into our next episode, and don't forget to follow us on Instagram and Facebook at NITZAMD. To explore more on this and related topics, visit our website, NITZAMD.com. If this episode resonated with you, please like and subscribe. And one more thing, share with the wonderful woman in your life.